We are working on one of the largest problems in the US. Basically, access to the healthcare that we all know and love is at stake.
The healthcare system is changing, insurance coverage is changing. You have to keep up with that to have relevant results, right? 5 years ago is no longer relevant.
If you think you can just say, oh, well, that's just the way we've done things, it's only a matter of time before somebody thinks of a better way to do it, and then you're out of business. And that can happen very quickly in a competitive market.
The way that we stay ahead is by relying on the great minds that we have across the firm.
We have tremendously smart people who are passionate about what they do.
A huge part of innovating and driving the research that we do is to include larger and larger swaths of the population, people of both genders, people of different racial backgrounds, people of different socioeconomic statuses.
I was working in data sets of hundreds of patients, and I thought that was a big cohort when I was in the hospital setting. And now working at Milliman, we have millions of people in our data sets.
The data we provide has a lot of value. It allows insurance companies to get this information very quickly rather than having to wait for it.
As any human, you really do want to do something that's not only serving yourself, but serving others. And I think Milliman does a really good job implementing tools to really help protect people financially as well as from an insurance standpoint.
We all have someone who is impacted by something that we work on because we touch so many different aspects of the healthcare system.
Any projection that we make might actually mean that a person might get to go to their doctor tomorrow or not.
When people interact with the healthcare system, you see how it really impacts their lives in a profound way.
If we can come up with ways to expand access, if people knew that they had healthcare, maybe they could take additional risk in other parts of their life. Maybe people would start more companies.
There's so many opportunities for not only improving people's health in terms of delivering better treatments, but also just creating a more efficient system.
Every dollar we're spending on healthcare, we're not spending on something else. It really has downstream consequences.
Those moments where you find out that something that you've done sitting at your computer pounding away at a data set actually has some real world consequences. That's really kind of what keeps driving me and keeps me pushing on these issues.
It's not about just making money. It's about your quality of life.
Our mission is to help our clients protect the health.
The health
and financial well-being of people.
People everywhere.
It's like my guiding philosophy. Do the right thing, do it the best that you can, and do it in a way that does right by everybody around you. And one way or another, things will work out.